So let's introduce our first speaker. Stefano Pessina is the Executive Chairman of Alliance Boots. Alliance Boots is Europe's biggest pharmacy chain with a presence in over 25 countries. In the 5 years since Stefano helped take over the company, trading profits have steadily increased, rising 12% last year to £1.1 billion, despite the tough economic climate. Stefano is going to offer his thoughts on the value to retailers of delivering health and wellness. Stefano.
Good morning, everyone, and it's for me really a pleasure to be here today, and thank you to the UK Trade and Investment for the opportunity to speak. I have to say that it's quite exciting to be here today at this time when the world attention is focused on London. The UK has a long retail history. Yes, it's true, as we have heard before, that Napoleon said that Britain is a land of shopkeepers. But over the years, these shopkeepers have been delivering world-class retail services, and they have created some of the most successful brands in retail, great brands, which have influenced the lives of millions of people around the world. And I am proud to represent one of them, one of these brands, Boots, which is a trusted retail pharmacy brand on the UK High Street for over 160 years. And for me, Boots is more than a retail brand. It's really the healthcare brand essence. This event gives us the opportunity to focus on some of the most pressing issues impacting our global community. Health and well-being is one of the biggest challenges for the world over the next future. It is one of the biggest areas of public spending and will continue to grow as populations age. And ironically, I have to say that the challenges that we now face is a consequence of improvement and innovation in care, in public health, in medicines over the last 100 years, because people are now living longer. And of course, they are aging and they need more care. And today in Europe, an average person lives around 20 years with one or more life-limiting conditions. And I firmly believe that retail has a key role to play in improving life conditions, and not only in helping people living longer, but also living healthier. Successful retailers are known for their ability to communicate with their consumers and inform their behaviors. And this is what drives our business and builds loyalties. We have over 17 million Boots Advantage loyalty card users. Boots in the UK is the market leader in spreading the message of feel-good, wellness, and health. Pharmacies can drive engagement and awareness, preventing people becoming ill in the first place, which of course is preferable and less expensive than taking them into hospital. Retail pharmacy can alleviate the increasing demand on doctors and take on more responsibility for a person's general health and well-being. Many of the services provided by primary care could be performed by pharmacies. We can rate good healthcare as well as good retailing more generally with the 3 A's: accessibility, availability, affordability. Accessibility to familiar and trusted services is essential for customers and patients, and should include professional support and advice that informs and reassures. Similar to retail, health services need to be built around customers and patients when and where they need them. Availability of quality products that meet the needs of the customers and patients are essential for improving their quality of life. Trust in the products and advice they receive is important in ensuring better compliance to the treatment. saving hundreds of millions of pounds a year of government public spending. Equally important is, of course, the affordability of health service and products. If products are not affordable, well, at the end, they are not accessible. Retail pharmacies, as other retailers, has a major presence on high street in many countries in Europe and outside Europe, and adds significantly to the local economy through employment and wealth generation. There is also an important role that retail pharmacy plays in narrowing the gap between being a customer and being a patient. Boots UK, for example, will support the customer throughout their lifetime as buying habits develop and their own circumstances change. Using this insight should offer better opportunities for optimizing the care they receive when they need it, enabling them to live healthier for longer. As the pressure on health spending continues, it is becoming even more important to demonstrate value for money for the payers. Keeping people healthier for longer is a strategic necessity for every society, especially if we are to avoid the negative social change as a consequence of chronic illness and aging. I believe it's essential for the future socioeconomic stability of all countries. Governments around the world must truly understand the potential impact of the challenges they face. They must ensure healthcare is sustainable over the medium to long term, supporting its development by a stable regulatory environment that reassures businesses like ours to invest. We need a focus on prevention and community-based management of long-term conditions. Retail pharmacy is well placed to deliver preventative healthcare and really start meeting tomorrow's challenges today. As a company, we can contribute to develop health service both in UK and internationally. The UK is a good market for enabling the development of health-based retail. It is stable with a strong and transparent regulatory system that provides reassurance to those seeking to invest. This is why we at Alliance Boots have invested over £1 million in our stores over the last 5 years. Boots is a household name in the UK, and our stores provide a broad range of services and products across health and beauty, such as No. 7 and Boots Pharmaceutical. Many of the products and services developed in the UK are now offered internationally, as we continue to make the Boots brand global, as a retail brand and via our products brand. We now have more than 500 Boots branded stores in Europe, Asia, and the Middle East. On our path to making Boots a truly international brand, we continue to spread the Boots product brand, such as our No. 7 range in the US and in many other markets. It is a great example of how successful we have been in exporting British products and British know-how in other countries. In countries where there are limitations on ownership of retail pharmacy chains, we work closely with independent pharmacies to provide high-quality services for them to deliver to patients. Alliance Boots' network of over 5,000 Alfiga pharmacies allows independents access to the benefit of a large healthcare company, including marketing and merchandising support, and enables them to offer an increased range of valuable services to local consumers and patients. Again, in a different way, here is another example of exporting services developed in the UK, or what I have just called British know-how, in other European countries. Retail pharmacy, like all retail, relies on good distribution support. Alliance Healthcare, our pharmaceutical wholesale business, operates in 21 countries and is the largest pharmaceutical wholesaler in Europe, and volume-wise, the largest in the world. We continue to develop our wholesale activity to help improve the quality of healthcare in the communities we serve. In the UK, Alliance Healthcare has been at the forefront of innovation in distribution. Over the last years, we have developed a broad range of new services to manufacturers and pharmacists that really have led the way to a new distribution model, which is imitated and followed by our competitors. Of course, starting from the UK, we have then implemented this new model in other European countries. And after all, this is another way to export the British know-how abroad. Some of you may have heard about our strategic partnership with Walgreens, the largest drugstore chain in the US. The new enterprise will operate over 11,000 stores in more than 12 countries and annually dispense 1 billion prescriptions. With regard to the UK, this is a great news for the country. We remain committed to maintaining all our support offices across Europe, including the Boots UK operational hub in Nottingham, which will benefit from the fact that our most popular product brands will be sold in the largest drugstore chains in the largest market in the world. And yet again, I am sure that we will succeed in transferring to Walgreens, together with our products, our British know-how in managing the front of the store for the pharmacies. In conclusion, today is mainly about retail and innovation. And I believe that my colleague at Allianz Boots and I have been able to bring our modest contribution within the healthcare industry. I am not British, as you can hear from my accent. However, let me say this. Since my early days in Italy in the late 70s, I have been working in many countries. But in creating new business models, in forging new deals, and in creating value, I have never been so successful like in the last 15 years, when I landed in the UK back in 1997, when Allianz Unichem was created. Since then, we have entered in an extraordinary phase of international expansion. And let me tell you this clearly. I am absolutely convinced that I would have never been able to achieve what I have achieved so far from another European country. All this has been possible in the UK because no other country in Europe is open to innovation and changes like the UK. I am sure that the British appetite for innovation will be always there, and the spirit of innovation will keep on spreading from Britain around the world. Many thanks for your attention.